Hi, I'm Amber Essenmacher, a physician assistant supporting patients with myeloproliferative neoplasms, or MPNs. When you're living with an MPN, it's really important to make sure your healthcare team knows how your condition might be changing over time. When I meet with patients, one of the most important things I do as a part of my ongoing care management approach is ask a lot of questions. I want to understand how my patients are feeling, whether or not their symptoms are improving, how their quality of life has been affected by their MPN, and so on. Keeping track of these things helps me and my patients recognize when something has changed. I can then adjust my MPN management approach as needed. So, one of the first things I ask about is sleep. I want to know if my patients sleep well at night. If the answer is no, I want to explore what might be causing them to sleep poorly. I'll ask about certain MPN symptoms, like night sweats or bone or abdominal pain, which could be affecting their sleep quality. Sleep can also be affected by things like stress or a physical issue, like snoring or frequent urination, so I'll also ask about those factors as well. I also want to know if they take naps during the day, and if napping helps their fatigue. Do they need to nap more now than they did a year ago? I want to understand their fatigue levels. Sleep quality is an area that MPN patients can look at on their own and discuss with their healthcare team. Another question I ask is, how are you feeling? That sounds pretty basic, but I want to know if they feel better now than they did before they started their individual care management plan. I use this question a lot because many of my patients still have nagging MPN symptoms, and those can be an ongoing challenge throughout the MPN journey. I will ask about common MPN symptoms like headaches, night sweats, fatigue, and appetite. For each symptom, I want to know, has it gotten worse since their last appointment? Better? Stayed the same? I'm looking for points of differentiation. I also find it helpful to ask if a close friend or family member has observed any changes in the patient's physical or emotional health in the past year. And if so, what changes did they notice? Quality of life is another area I often explore with my patients. For example, I want to know if they are worried about their health. Do they worry about the financial impact of their diagnosis on themselves or their family? I also want to know if they have concerns about their employment status. For example, has their diagnosis, MPN management, or general health impacted their ability to work? Have they had to retire or leave a position due to poor health in the last couple of years? Have their symptoms or treatment limited their ability to travel or other retirement plans? Are they able to enjoy time with friends and family as much as they did a year ago? I also want to know if their diagnosis, treatment, or general health has impacted their ability to participate in special hobbies or favorite pastimes. What I'm getting at is whether or not their overall quality of life has been affected in either a negative or positive way, and how that is changing over time. For example, what things can you no longer do or enjoy that you previously could? It's important to keep in mind that answering questions about your overall health and how your MPN is affecting your life can provide your healthcare team with important insights about how to manage your condition. You can also initiate that conversation with your healthcare team by going to your next appointment armed with relevant answers about your own health and well-being. Remember, it's important to take an active role monitoring and managing your own health. Be sure to talk with your healthcare team about any changes in your condition or about any questions you might have.